I'm going to be your nurse today. We're going to be performing a head-to-toe assessment. It should take about 20 minutes. Is that okay with you?
Yes.
And can I ask you to state your name and date of birth for me, please?
Kira Johnston, 2601.
Okay, great. And when I look at your wristband, that's indeed what it says. Can I ask if you have any allergies or if you're allergic to any medications that I should know about?
No.
Okay, and are you experiencing any pain today?
No.
Okay, great. So I'm going to start the assessment. So I'll start with a general survey. So when I look at you, you are not showing any signs of acute distress. You don't seem like you're in pain or anything like that. You seem conscious and alert and aware of your surroundings. May I ask, what month is it today?
April.
Okay, great. And what city are we in right now?
Chicago.
Okay, great. So the patient is alert and conscious and aware of their surroundings and oriented. So when I just look at you and inspect everything right now, I see that your posture is nice and upright. I don't see any abnormal curvature or bending of the spine or anything like that. I don't see any obvious physical deformities or abnormalities. When I look at your skin, it's nice and uniform in color. I don't see any redness, jaundice, erythema, or cyanosis or anything like that. You seem not malnourished. Your nutrition seems nice and healthy. May I ask you to state your height and weight for me, please?
I'm 5'5" and 135 pounds.
Okay, great. So your BMI is within normal limits. That's very healthy for your age. You look about the age that you stated. I don't see any other physical abnormalities. I don't know any wounds, lesions, or rashes along your skin or anything like that. I just see a few tattoos, which of course are intentional. And when I did see you walk in today, I saw that your mobility was nice and normal. You weren't shuffling, your gait was completely normal, and you weren't struggling to walk and you weren't limping or anything like that. So I'm going to start by inspecting your skin and nails today. So like I said, when I did observe the skin that is visible, I didn't see any wounds, lesions, rashes, or scarring or anything like that. And I'm going to palpate your skin to feel its temperature. So when I feel your skin, it's nice and dry, there's no sweating, and it's nice and cool. It's not overly warm or anything like that. When I look at your fingertips, they're a nice and pink color. They're not dusty blue or anything like that, indicating cyanosis. And when I inspect your nails, they are nice and flat. They're at a 180-degree angle. I don't see any abnormal curvature or bending or spooning of the nails, and the nail beds are a nice and pink color. So I'm going to press down on your nail bed to assess for capillary refill. So when I press down on it, your nail bed returned to a normal color within 3 seconds, which is perfectly great. So I'm going to assess your head and neck now. So I'm going to start at the scalp. So when I inspect the scalp, I'm looking for any abnormal masses or lesions. I don't see any. I don't see any bumps or anything like that. I don't see any discoloration of the scalp. When I look at your hair distribution, it is evenly distributed throughout the scalp. I don't see any balding patches, and your hair is a nice and thin texture, which is great. Your hair doesn't seem to be decreasing in quantity in certain areas over the other. And I don't know any foreign objects such as lice or anything like that. So when I look at your head, it is nice and midline along your neck, and it is positioned upright. It's proportional to the rest of your body. And when I assess the skin on your face, I don't see any redness or jaundice or cyanosis or anything like that. And your skin looks perfectly normal. Okay, so I'm going to assess your eyes now. So just by inspecting your eyes, when I look at the pupils and the iris, they are equal in diameter and color. I don't see any anisocoria or strabismus. Both pupils are equal in diameter. And when I look at your sclera, it's nice and white. It's not red. I don't see any jaundice or yellowness of the sclera, which is great. Your eyes seem pretty moisturized and not dry. When I inspect your eyelid, I don't see any swelling or redness of your eyelid. I don't see any drainage coming out of your eyes, which is great. And your eyebrows are nice and symmetrical and proportional to the rest of your face. So I'm going to shine a light in your eye and test to see that your pupils constrict. So I'm just going to shine a flashlight in one eye. So just look straight ahead. Okay, And when I shone the light in one eye, the other eye will also constricted, which means that both pupils equally react to light. I'm gonna have you stare off into the distance, just look at the wall over there, and then I'm gonna bring this object closer to your face and then just follow it with your eyes. Okay, so both of your eyes moved in at the same time, which means that they are accommodating. So that means your eyes are all good to go. Okay, so I'm going to inspect your nose now. So just by looking at it, I do see that you have 2 piercings. Those are obviously intentional lesions, but I don't note any other abnormal lesions or inflammation or redness or swelling of your nose. If I could just have you cover one nostril for me, please, and then breathe in and out of the other. Okay, great. And now cover the other nostril for me, please. Okay, great. So both of your nostrils seem nice and patent. It's not like you're struggling to breathe in and out or the other. And I don't know any drainage coming out of your nose at all. And your nose is nice and proportional and midline to the rest of your face. So I'm going to inspect your ears now. So do you mind if I ask if you've had any changes to your hearing in the past few months or weeks?
I haven't.
Okay, and do you work a job where you hear a lot of loud noises frequently?
No.
Okay, and do you use any hearing aids?
No.
Okay, great. So I'm just going to inspect the outside of your ear. So when I look at it, I do see a piercing, but that's of course an intentional lesion. I don't see any redness or swelling or abnormal growth, such as like crystals or anything like that. And when I look at your other ear, it's the same thing. They're both symmetrical and proportional to the rest of your head, and I don't see any abnormalities there. Okay, great. So I'm going to inspect your mouth now. So just by looking at your lips right now, I see that they're nice and pink. They're not dusty or blue color. They're not. They look adequately perfused. So if I could just have you open your mouth for me, please. Okay, so when I look at your mouth, I don't see any abnormal structures on your teeth, and your teeth seem nice and white. I don't see any structures such as dental caries. And when I look at your gums, they seem nice and pink. They don't seem overly red or inflamed or swollen. I don't see any sores or wounds or lesions or rashes or anything like that along your gums. When I look at your tongue, I see that it is a nice pink color. I don't see any whitish substance on the top indicating thrush or anything like that. And it's a nice pink color. It's not red or anything like that. And if you could open your mouth and lift up your tongue for me, please. Okay, great. So your oral mucosa seems nice and moisturized. I don't see any cracking or dryness or any signs of lesions in your mouth. And if you could open your mouth and say "ow" for me, please. Okay, so I saw your uvula and it was nice and midline to the rest of your throat, and I saw your posterior pharynx, which was not inflamed, and it was a nice pink color. I didn't see any swelling of the tonsils or any drainage or anything like that. Okay, great. So I'm going to assess your upper extremities now. So when I look at your arms and just do a general inspection, I don't see any wounds, lesions, or rashes, swelling, or irritation to the skin at all. When I look at your joints, they seem nice and normal. I don't see any swelling or inflammation or gross or weird bending going on. And when I look at your wrists and your joints on your fingertips, same thing. I don't see any abnormal growth or swelling or bending or anything like that. So I'm going to palpate your skin for skin temperature, if that's okay with you. And your skin temperature is nice and normal. It's dry and your skin is nice and cool. So I'm going to test your range of motions on your arms and your wrists. So if I can just grab your arm, and I'm just going to bend it a little bit. Okay, and on your other arm. Okay, so it seems like you have full range of motions of your arms and wrist joints. So I'm going to assess for your upper body strength. So I'm going to push down against your shoulders and you push up against your hands. Okay, and if you could stick your arms out like this for me, please. Now I'm going to push down. Okay, and now I'm going to push up and you push against me. Okay, great. So you have great upper extremity strength. You weren't struggling to push up against me, and you didn't feel weak or anything like that. I'm going to palpate your radial pulse. I'm going to start on this arm right here, and I'm just going to feel your radial pulse. Okay. Okay, and I felt both pulses. They're both present, and they probably have an amplitude of 2+. Okay, so I'm going to move on to the respiratory system now. So when I observe your breathing patterns right now. I see that you're not struggling to breathe. Your breathing isn't labored, anything like that. I don't see any use of any accessory muscles or anything like that. So I'm going to also take the 14 lung fields. So every time I move my stethoscope, I'm just going to ask you to take a deep breath in and out, okay?
Okay.
So first I'm going to listen to the tracheal sounds. Now bronchovesicular. Vesicular. Okay, and now I'm going to listen to them on your back, so if you could scoot over here for me, please. Thanks. Okay, and now same thing, I'm just going to listen to a few different points. Breathe in. Okay, great, thank you so much. So I listened to all 14 lung fields. I didn't hear any, I heard only normal breath sounds. I didn't hear anything abnormal like stridor, wheezes, or crackles, or anything like that. And I listened to your tracheal, bronchovesicular, and vesicular, and everything sounds great. So I'm going to assess your cardiac system now. So I'm just going to palpate your carotid pulse on your neck. So I'm just going to feel on each point. Okay, great. And your carotid pulse is present in both places. I'm going to also tape for your heart sound, so I'm going to start at the top of your chest. So you don't have to breathe in or out or anything like that. Okay, and I also tated your apical pulse for 1 full minute, and it sounded all nice and normal and everything like that. Okay, so I'm going to assess your GI system now. So may I ask when your last void was?
An hour ago.
Okay, and when was your last bowel movement?
5 hours ago.
Okay, great. So that's nice and normal. It wasn't like a long time ago or anything like that. So if I could have you lay back for me, please. I'm going to listen to your bowel sounds in all 4 quadrants of your abdomen. So left upper quadrant, right lower quadrant, left lower quadrant. Okay, and I heard bowel sounds in not all 4 regions. I didn't hear an absence of bowel sounds in any of the other regions. So I'm going to lightly palpate each area and let me know if there you feel any tenderness or anything like that. Any pain?
Mm-mm.
Any pain?
No. No.
Okay, so when I palpated, I didn't feel, oh, you can sit back up for me. Thank you. So when I palpated, I didn't feel any tenderness, I didn't feel any rigidity, I didn't feel any masses or anything like that. And when I did inspect your stomach, I didn't see any abnormal distension or swelling in a certain area or anything like that. So I'm just going to move on to your lower extremities. So when I inspect your lower extremities of what's visible, I don't see any redness or jaundice or cyanosis or anything like that. I don't see any lesions, wounds, or rashes or scarring or anything like that. Your toes are nice and profuse. They don't look cyanotic or anything like that. I'm going to palpate your skin and I'm going to feel the temperature. So when I felt your skin, it was nice and dry. I didn't feel any extreme redness or any warmth or anything like that. You're not sweating or anything like that. And so I'm going to test the range of motion of your joints. So if you could just relax your leg, I'm just going to lift it up a little. Okay, and okay, Okay. Okay, so it looks like you have full range of motion of your joints and everything like that. When I inspect your joints, I don't see any swelling or I don't see any peripheral edema. Both legs are bilaterally uniform. I don't see any abnormal bending or distension of any of the joints on your feet or on your ankles and knees. So everything looks nice and normal. I'm going to palpate for your dorsalis pulse. Okay, and I felt your pulse on both feet and it is present. And that concludes the rest of our assessment. So I have left the bed in the low lock position, both side rails are up and the call light is within reach. And do you need anything else from me today?
No.
Okay, great. So thank you so much and I will see you later.
Something happened.